Hello, everyone, and welcome to week 3 of your 30-day collagen loading challenge. And this week it's all about bone, joint, pain, and inflammation. So let's get started. Why collagen is so important and what it does to your body. So, week 3, collagen and bone health, collagen and joint integrity, pain and inflammation, and what destroys our bones or joints and how to prevent it. So that's what we're going to cover this week. And let's kind of review. So this is really ingrained in your head. There are at least 28 different types of collagen. And probably within the next year, we're going to find more. It's going to be in the 30s and 40s. So 90% of the collagen in your body is type 1. So where are we finding that type 1? In your skin, arterial walls, your bone, teeth, tendons, and ligaments. Type 2 is primarily found in hyaline cartilage, the cornea of the eye. Type 3 is often found with type 1. That's going to be in your blood vessels, spleen, lymph nodes, uterus, skin, intestine, internal organs. Then we have also type 4, which is mostly islands and the kidney. So type 5 also supports type 2. Like I said, we see a lot of 1 and 3 together, but 5 it actually supports type 2, and it's a specific type of collagen for the surface of the cells and for the hair strands. So that's why just 1 and 3 really doesn't help a whole lot for the hair. You've got to make sure that you're getting that combo in there of the 5. And that's why I prefer the multi-collagen for maximal benefit. And also type 10 is for bone formation and cartilage. So let's review again collagen in your body. This is what the collagen fibers look like. You can see that they're little bundles, and you can see the little helix there, that what that looks like. And they're pretty strong fibers there. Skin is 75% collagen, bone is 30% collagen, and your blood vessels 40% collagen. So I think by now you understand the importance of why you need to be consuming collagen. And as we covered in the previous week, the first week, why we are so low in collagen, why most humans lack this. And a lot goes back to the diet, of course, not eating nose to tail animal products, and also because we tend to remove the skin and we don't know on some of the chicken, the bones and joints and so forth. So in your joints, 90% of the ligaments are made up of collagen. So in the tendons, and 80% cartilage, 70%. So now, as you can see, it's really important. And as a preventive measure, it really helps, especially people that are athletes, you're working out. It's going to be really important to make sure that you get sufficient collagen. So let's go back to some of the bone basics now, since this is all about bone health this week. It's about joints and pain and inflammation. So most of us think the bone is not a living organism, but it really is. There's a lot of activity going on inside the bone. Of course, you've got blood vessels, nerves, there's bone marrow, and it is a growing tissue that is constantly being remodeled. And it starts to peak in the mid-20s, about age 28. Therefore, it stops building. The density in natural bone does start to occur, by the time you reach your 3rd decade of life. I know, sounds disheartening, right? So this is one of the most progressive diseases, and I really believe that it's overlooked, and that's why I really wanted to share. And there's actually something you can do about this, and it's osteoporosis. It's also known as the silent disease. It is a progressive bone disease, and it affects the bone mass, therefore also the integrity, and you have less bone strength. So there's no signs and symptoms, and a lot of the times the way a person knows that they have osteoporosis is until an injury, something happens. All of a sudden they're like, gosh, I'm getting this intense back pain, or they fracture their hip, and it's like, well, where did that come from? Once again, it is the silent disease. It's the most common disease in humans, in more than 200 million across the world. So it does tend to increase with age. So what about women? Women and bone health is really important because women lose about the average of 0.4% in bone mass, especially in that femoral neck. That's why they get those hip fractures per year. It even intensifies after menopause because of the loss of estrogen. Therefore, you have bone loss also increases. That's why so many women choose to um, move forward with HRT because of the estrogen loss in order to preserve bone density. That'd be a whole other conversation for that. But the average loss is about 2%. It occurs 5 to 10 years postmenopausal. So if you really want to know, and I think every woman, at least by the time they reach their age, the age 50, should get a DEXA scan. I think that's one of the best ways to check the bone density and for women. And it's not that expensive. It's maybe $100 out of pocket if you have insurance and you ask your practitioner, hey, I'd like to get a bone. I want to see what my bone health is like. I want to get a DEXA scan. They probably can refer you, write you a prescription and have your insurance cover it. If they're not, you're worth $100. Go pay the $100 and get it done. And you should have one done every 2 to 4 years. So that way you can monitor and make sure that, your bones are strong and healthy. So let's talk about what actually helps the bone. You need calcium and other minerals for collagen production in order to have the proper signaling pathways so you can have healthy, strong bone growth. And also it's important for the quality of the matrix. Vitamin D is super important, not only for bone health, but for overall health in your body. I think now most doctors are testing for vitamin D. So that's also really important. I think it's more important than calcium, vitamin D for bone health. So let's take a look at your bone matrix. This is what low collagen bone looks like. This is what a healthy collagen on the right looks like. So there's actually a couple phases here. So you have a mineral phase, which has calcium and other minerals, and that provides the stiffness of the bone. And that's approximately compromises 70% of your bone matrix. Then you have another part, which is the collagen fibers, and they provide the toughness and the ability to absorb the energy. So they're beautifully paired together, because when they're both paired together, this allows for the bone flexibility, it allows for strength, and therefore it adheres to stretch so much better than just having one. So I think that's what a lot of people make the mistake, especially women. They think that if they take calcium, that's all they need for healthy bones, and that's farthest from the truth. You're going to benefit more with vitamin D and a combination of collagen. So collagen, what does it do for bone? Well, it serves as the framework to basically hold that calcium into the bone. So therefore, the more collagen there is in the bone, the more places for calcium to actually be incorporated or bind to. So it's really important to have collagen, because the more you have, the more bone toughness you're going to have. The less collagen you have, the less bone toughness, the less surface area for calcium to actually bind to. Therefore, this is going to put you at risk for a fracture, especially those hip fractures that we were talking about. So what about collagen and joints? Let's take a look at this. This is what a joint looks like. This is a beautiful example of a knee. Is that basically it's just a connection made between bones and the body. So you've got an elbow joint, you've got a knee joint, shoulder joint, hip joint. But let's take a look at the knee. There's just so many people that have knee problems, but you've got your cartilage here. You see how beautiful that is right here. And what happens is cartilage, its job is to reduce the friction of the movement between the two bones there. And type 2 collagen is important in the cartilage. Therefore, it's important that you have a multi-collagen instead of just the 1 and 3, which typically a lot of people only purchase the 1 and 3. But if you want to have joint health and also hair, as we talked about, you want to make sure that you're taking a multi-collagen versus just a 1 and 3, even though, as we know, that 90% of the collagen in your body is type 1, you still need the other types. Collagen peptides are really, really helpful because they're already pre-digested, and it makes these amino acids more easily available. And as you recall, your amino acids are the building blocks of protein. So collagen, once again, 90% is type 1. Type 1 is in the bones, tendons, and ligaments. What about pain? Let's take a look at that. How does collagen and pain, what's the connection? Can that help? We'll take a look at this. This is what a healthy knee looks like. This is what a knee with osteoarthritis. Most people that have osteoarthritis have what? Pain. And pain is what? It's your body's signaling pathway telling you something is not right. It's really just an uncomfortable sensation. It's associated with tissue damage. So it's telling you that something's not right. So don't avoid pain. We do have acute pain, which is usually temporarily, and it goes away once the cause for it has been treated. An example would be like sore muscles from working out. That's not a big deal. I have a young daughter that plays sports, so I will give her collagen. I will ask her to also ice her body, and of course, making sure that sufficient protein is consumed for the repair process. So constant pain in the body, what happens is it will create a sustained cortisol output. We have cortisol being pumped out of those little adrenal glands on a continuous basis. This will actually break down collagen. It has also been linked to inflammation, bone loss, and a compromised immune system. So you don't want to avoid pain. The pain is a signaling pathway, so you've got to trace the cause of what is the root cause of my pain. You see, most of the time, pain and inflammation are paired up. And inflammation is really a destroyer. It is. Here's some ways it can damage your body, because when there's inflammation, cortisol is the cousin that is usually not too far behind it. So what happens? There's inflammation will create joint pain, loss of mobility, increased cardiovascular risk, loss of bone, loss of muscle tone, accelerated skin aging and wrinkles. We definitely don't want that. It impacts your memory because the inflammation and the cortisol impacts the hippocampus portion of the brain, compromises digestion of the gut, for one, because it interferes with your stomach's production of hydrochloric acid, and also can lead to leaky gut, and of course the weight gain, because your body's in a crisis situation. So it's not going to, its job is not to, hey, let's lose weight, let's stop thin out. It's more of like a protection mechanism, and also the stimulation of abnormal growth of cells, of healthy cells there. So let's talk about collagen and inflammation. As we mentioned, inflammation is a normal process of the body. It is the first response of the immune system to any type of infection. There's an injury or irritation from some sort of foreign substance. That's one of the first responses. There's going to be inflammation. So you have acute inflammation. An example would be like if you sprain your ankle. There's going to be some redness, there's going to be some pain, there's going to be swelling, and there'll probably even be some warm sensation in the area. So what happens during this time, the inflammatory process will include the release of cytokines like C-reactive protein, and often these are tested when you get blood work done, and also interleukin-6. If you are getting blood work done, it's a good idea to get C-reactive protein added in there. Once again, it's not a very expensive lab marker. It's probably less than $10. Ask your doctor to add the C-reactive protein, because that is going, if that's elevated, it's telling your body that you're inflamed. And even though you may not even feel the inflammation, that inflammation can be coming from other areas. It could be in the brain, it could be in the gut. Your body is under attack. So it's important to find out why. It's just basically giving you a clue, and it's time to investigate more. The purpose of inflammation is to remove debris, any foreign invaders, bacteria, cellular waste, and also to facilitate a healing process. The downside of inflammation, well, there's good and bad news. You know, it's like a two-edged sword. It's, you know, when it's chronic inflammation, that leads to oxidative stress. Oxidative stress and free radicals, they destroy the connective tissue and collagen, which leads to what? Aging. It shows up in your skin. This will create a long-term inflammatory process. Therefore, it leads to pain and degradation or breakdown of the joints throughout the body. So that's not a good thing. Inflammation can be our friend, but it's there to signal to let you know something's not right. So go after the root cause of the problem. So how do we destroy our bones and joints? How did we get to this place? Well, there's a lot of reasons. I'm going to basically cover the top four. One's going to be the inflammatory diet. I've talked so much about diet. We're going to review what it is. Again, too much stress on the joints, lack of recovery time, not sleeping enough, not getting enough rest between the workouts, and of course, environmental stressors like smoking and chemicals will destroy that. So you want to preserve your joints by dietary changes, which we're going to cover, exercise, anything that's going to force you to be able to get stronger, and also flexibility. So Pilates, yogas, weight, bands, those are all great. Some of the foods that cause inflammation, I've covered these. Sugar is your enemy. Sugar will age because what does sugar do? It breaks down the collagen. That's why you can see a person once they give up sugar, and that's why I love the keto diet so much, is because it's a high fat diet. You remove the sugar from your diet, your skin looks so much better and you look younger. Any of your conventional red meats, anything that's like a lot of the processed meats as well. I buy everything grass fed. Dairy products like your milk, your cheese, your yogurt, those create inflammation. So does gluten, which is found in your breads and your pastas, your cookies, your pastries. So gluten like wheat, oats, rye, and barley. Yes, even oats. Too much coffee and alcohol can also contribute to inflammation, and your hydrogenated oils, which you will see in a lot of anything that's packaged, is going to have some hydrogenated oils. So it's mostly vegetable oils and canola oil. So there's some herbs and spices that will help with the inflammatory process: turmeric, ginger, hops, and rosemary. So I love turmeric because of the curcumic content in there. So let's talk about anti-inflammatory foods. Omega-3 fatty acids are the best, which you're going to find in wild fish and cold water fish. You also can find these in ground flax seeds, freshly ground flax seeds. You don't want to buy them ground. You want to actually get them fresh, and you can grind them in like a little coffee bean grinder, and walnuts as well. So some of the other bone builders are going to include your vitamin D, which we talk about, magnesium, some of the botanicals like adaptocrine, or what I call adaptocrine, something I use, adaptogens, like rhodiola, ashwagandha, or shashandra. Those are my favorites because they're there to help with stress management. Vitamin C is also important, and vitamin K and calcium. So those are the other bone builders for bone health. Collagen and menopause. Loss of collagen is directly tied to your estrogen level. So it's really important that especially women, as they start going through menopause, you try to keep healthy estrogen levels, because it does help your skin stay thicker and retain the moisture. And that's what you see also when women as you get older, the lower the estrogen levels, the lower your collagen. So there is a time and a place for women to get hormone replacement therapy. That's a whole different conversation, but some of them choose to do that, but it's not ideal for everyone. So these are some ways that you can stimulate collagen. One, you gotta clean up your diet. That's the one thing that you can do. You're removing the sugar and the dairy and the gluten for some people. Collagen peptides, which is all about. That's why I'm encouraging you to take a multi-collagen, improving your gut function with digestive enzymes and hydrochloric acid, because you want to make sure that you are getting the maximum absorption of your foods. Staying hydrated, vitamin C, stress management. You got to manage your stress. Biotin-enriched shampoo for hair is great. There's a product called BioSol for skin and hair. But you want to make sure that your beauty, what you look like on the outside, really is a reflection of how healthy you are on the inside.